Hey everybody, welcome to week 6. We are going to jump into our other major group of gram-positive cocci this week, and it will be strep and enterococci. So you probably have already heard about these two groups, especially from last week when I talked about them, but we are officially going to go through them today. I'm just going to share my screen so I can pop up the PowerPoint here, and we will just get started. Okay, so Streptococcus and Enterococcus. They are gram-positive cocci, just like it says. The biggest feature here that differentiates them from staph is that these two groups are catalase negative. Now remember, last week, all staph and micrococcus, because micrococcus was in the staph chapter, all staph and micrococcus are catalase positive. So they will bubble with that hydrogen peroxide test that you guys do in the lab. Whereas all strep and enterococcus are catalase negative. So that is the big test that will differentiate these two large groups of gram-positive cocci. So a little bit of a note here, Enterococci sometimes can appear very weakly positive for catalase. Again, it's very lightly bubbling, hardly any positive reaction at all. We overall consider Enterococcus negative, so we just stick it with the strep and Enterococcus. But once in a while, you might get that really weak positive reaction on catalase, and that would be a good indicator that probably it's an Enterococci. Again, I already answered this, but just to refresh, Staphylococcus is, again, catalase positive. Okay, so gram-positive cocci, streps tend to be in chains. There is one strep that will occur in pairs. Now, again, last week, Staphylococcus, we learned it was gram-positive cocci, and it tends to be in clusters. Now, you can't obviously go just by the gram stain on, oh, it's chaining, it has to be strep. You can't do that. But it gives you kind of a tendency of what you might think it might be. So, again, you first gram stain it. The minute you see it's gram-positive cocci, you would then catalase test it, and then that would kind of help you determine, do I have staph, do I have a strep or enterococcus, and what test to perform next. So there's what strep can look like when it tends to chain up, nice long gram-positive cocci. You see the dark purple balls there right in a line chaining. Here's what it would look like when it occurs in pairs. The strep that always occurs in pairs is called Streptococcus Pneumoniae. I have a slide on it later here. But that is the big one that occurs in pairs. That's a major pathogen for us, by the way, so it is something we definitely look for in the lab. And in these pairs are said to be cat-eye shape, or they call it lancet shape. So think of like that nice cat-eye almond shape to it. That's what they tend to call these pairs. Now, I know it's probably hard to see, but when you look, you can see a little line in between each one separating the two cocci. But if you look right here, I don't know if you can see my arrow, but down to the bottom left, I'm circling one that really has that nice cat-eye shape more to it, and you can see there's two of them in a pair. That's a good example of it there. But overall, when you look through this whole thing, most of them are always occurring in twos. All right, the other big thing that I want to note when we jump into streps here is not only do we call these streps by their real name, but you might also hear them called by a Lancefield group name. So if I say group A or group B strep, that means something. So there's kind of two different names on some of these, and that's because these Lancefield groups have been created based on different carbohydrate antigens that might be on the cell wall of the bacteria. Now, not every strep is going to have a Lancefield group. There's a couple that don't have any group name at all, so you don't have to worry about a group name with those. But be sure that you can interchange the names. So if I were to say to you the real name or the group name, you know exactly which bacteria we're discussing. So here's kind of what the groups are. We will definitely discuss groups A and B today and D. We're not going to really focus much on groups C and G. As you can see there, they're less frequently seen in the clinical lab, but we'll definitely focus on A, B, and D. And then the ones that don't have a group are Strep Pneumoniae, and then a group that we call Viridian Strep. Those two don't have an actual group name assigned to them, so those are just called either Strep Pneumoniae or Viridans. Hemolysis patterns are going to become really important when you're looking at possible strep colonies. We always follow a flow chart system of testing in the lab. You saw that hopefully beginning to see that last week with staff in doing your lab work. Plus, I put up, I think, a flow chart in the announcements, one that a lab might follow. Every hospital lab's flow chart might vary a little bit just depending on what test that they choose to run. But usually we're always following a flow chart. So we'll start at the top, we get gram-positive cocci. Next step is usually catalase. If it's catalase positive, then we do coagulase, you know, that kind of thing. Whereas with this, with streps, you know, you get a gram-positive cocci, then you catalase test, and if it's catalase negative, then you kind of have the feeling you might have a strep on your hands or an enterococci. Then you look at the hemolysis pattern next. So that's hemolysis pattern is the next step after catalase negative in the flow chart for strep. And the hemolysis pattern will tell you then which test you run after you determine the hemolysis. So here's a reminder of what the different hemolysis patterns are that you should still know. Again, alpha hemolysis is a partial lysis, and it tends to be a green color. That's the middle picture on here to the right. The middle one is the green color. Beta hemolysis is a complete lysis around the colonies. That will be a clearing or a halo effect. That's supposed to be the bottom picture. Hopefully you saw this because Staph aureus is definitely beta hemolytic. So if you played with Staph aureus last week, you should have saw beta hemolysis. That's the one where you hold it up to the light, you can see the clearing around the colonies. And then again, gamma hemolysis is just no lysis at all. Nothing happened there. So here's the example of a beta hemolytic strep that you might see. You can see the definite halo clearing around the strep colony. Reminder, like I said last week, streps tend to be smaller, more pinpoint colonies, whereas staphs were bigger, creamier colonies. This is an alpha hemolytic strep. I know it's a little hard to see on here, but it gives that green hue. You can kind of see it in the shadows of the plate here on the right side. It looks more visible. You can see the green hue it took on with that partial lysis, so that would be an alpha hemolysis. So here's kind of how your hemolysis rolls. Again, we'll mention them as we go through each strep. Groups A, B, and C tend to be beta hemolytic. Group D tends to be alpha or gamma. Strep pneumoniae and viridans are definitely alpha hemolytic. And then Enterococcus can actually be any of the three hemolysis, so that one actually does vary. But you can see where the rest of the streps really are dependent on their hemolysis patterns that they do. Okay, so now let's finally discuss the main pathogens out of the Strep and Enterococcus chapter. So we're going to start with our big bad boy Strep Tiogenies first. This is Group A strep. So again, know these names interchangeably, whether I say Group A strep or Strep Tiogenies, it should mean the same thing to you. Very much a beta hemolytic strep. So again, you're going to see it's gram-positive cocci, then it's catalase negative, and then you look at the hemolysis and you'll discover beta hemolysis here. I'll talk about the other tests that you would run then after this soon, but a little bit on Strep Tiogenies. It can be carried sometimes in the upper respiratory tract. It is not normal flora, though. This is one that doesn't usually, gosh, I have bad English today, is not usually normal flora of our body. We might carry it, and if you find it in the upper respiratory tract, it is definitely clinically important because this is the guy that causes strep throat. We all have heard of strep throat. Many of us have had it, and this is the main cause of that. So that's why it's so clinically important if you do find it being carried in the upper respiratory tract because it definitely causes disease there. So again, not normal flora otherwise on our body. It'll just tend to colonize and hang out waiting for a chance. All right, virulence factors. Strep Tiogenies is extremely virulent, extremely pathogenic, meaning loves to cause a lot of different diseases. So it has a lot of things it can produce to cause that disease it needs to. So the biggest things here are listed. There's probably more. I just listed some of the main ones. If you've taken immunology, you might have already learned some of these, but for those that haven't, here they are. The M protein is basically, in order for Strep Tiogenies to ever cause a disease, it has to have the M protein. If there is a Strep Tiogenies that does not have this protein in it, it won't cause disease. This M protein is there to allow for the production of its virulence factors. It also helps it get resistance against phagocytosis. So with that M protein, the bacteria can then produce these various virulence factors to help it cause its diseases. If it's missing that M protein, then it can't really produce the virulence factors it needs. So you can see how it needs to have this M protein to produce disease. All right, Streptolysin O and S, these are what makes it beta hemolytic. The Streptolysin O will create holes in the blood agar. I always sound out the holes to make the O sound. That will cause holes in the blood agar, and then Streptolysin S really lyse those red cells then and cause that complete beta hemolytic pattern. Now, these also do stuff in a patient's body as well. And in fact, there is a test in the lab called an Anti-Streptolysin O Test, ASO for short, Anti-Streptolysin O, ASO. What that test does is it tests for the patient's antibodies against this Streptolysin O. So whenever we as a patient have Strep Tiogenies, we can make antibodies against the Streptolysin O virulence factor to try to fight it off. And so as a result, we have created a test where we're monitoring and measuring the level of antibodies that patient has. If they have a high amount of antibodies against Streptolysin O, that's a sign that they just had Strep Tiogenies infection. Because the only time you really have a high amount of antibodies against Streptolysin O is if you've been exposed to Strep Tiogenies. So ASO titer is a really good one to detect recent infection with Strep Tiogenies. So it should be a high level there to detect that. Hyaluronidase is a spreading factor. This is an enzyme. It basically will help spread through the connective tissues, kind of destroy them to get through them into the body. It wants to penetrate further into the body. DNase is an enzyme that attacks DNA in our cells. And then there's lots of other exotoxins. There's one exotoxin that it produces called an Erythrogenic Toxin. Again, that was erythro, as in red cells, think of red, Erythrogenic Toxin. That's actually what's responsible for a rash with scarlet fever. If scarlet fever is caused by Strep Tiogenies, that's another disease that it causes, and there's a specific exotoxin that makes the characteristic scarlet fever rash that goes with it, and that's that Erythrogenic Toxin. Another exotoxin that Strep Tiogenies produces can also cause toxic shock syndrome. We heard about toxic shock syndrome last week with Staph aureus. So both Staph aureus Strep Tiogenies can produce toxic shock syndrome due to the toxins that they release. All right, so there is a ton of diseases with Strep Tiogenies. So kind of similar to last week where Staph aureus was our big bad boy pathogen and it caused so much disease. Strep Tiogenies this week is our big bad pathogen that causes a ton of things. Lots of skin infections with this one, so impetigo, cellulitis is mentioned there. Scarlet fever kind of involves the skin with the rash. Again, strep throat is probably your most common disease caused by Strep Tiogenies. You can also call strep throat pharyngitis. Toxic shock syndrome is listed there. Necrotizing fasciitis, that's that flesh-eating disease. Now, not all strains of Strep Tiogenies will cause necrotizing fasciitis, thank the Lord, but there are certain strains that can kind of eat their way through the muscle fascia it's very deadly. If you ever want, Google those images, my goodness. And then there are two diseases at the bottom that you'll notice there that are called post-streptococcal diseases. These are infections that might occur following having a Strep Tiogenies infection. So they're kind of complications after having a Strep Tiogenies. So rheumatic fever often follows after having respiratory tract infections. And again, rheumatic fever involves like the heart. Acute glomerulonephritis will follow either respiratory or a skin infection with Strep Tiogenies, and this would be damage to the kidneys. So it is thought that the antibodies that your body makes to fight Strep Tiogenies kind of causes some of the damage to either the heart or the kidneys as part of the process. There's a lot more to it than that, of course. I'm just simplifying it way down. But again, these are considered too complicated or post-strep diseases after having a group A Strep Tiogenies infection. And of course, this list isn't conclusive. There's tons more diseases out there for this guy. Okay, that was probably way enough on Group A strep. Let's move to Group B strep called Streptococcus A galactiae. This is our other big beta hemolytic strep. I know there was one more that was Group C. Again, we're not really going to discuss Group C beta hemolytic strep. Group A and Group B beta hemolytic streps are our two biggest ones that we're concerned about. So Group B, Strep A galactiae, is heavily associated with neonates, so newborns, and it is usually acquired in the birthing process. So you'll notice if you skip down past the virulence factor for a second to the disease, it causes neonatal meningitis. So in other words, meningitis in that newborn. What this is if any of you women have been pregnant, at some point during your pregnancy, you were swabbed to see if you carried Strep A galactiae or Group B strep in your vaginal tract. If you carried that Group B strep down there, you were given antibiotics to wipe it clean. That way, when you give birth, your baby doesn't pick up that Group B strep upon birth. If you had Group B strep there still and didn't get rid of it, it could be passed to your baby upon delivery, and then it results in meningitis, which is, of course, really serious condition. Your baby doesn't really produce antibodies yet. You know, they're very immunosuppressed, so it's very concerning. That's why as standard protocol in every pregnancy, they screen every woman to see if she's a carrier of Group B strep so that they can give antibiotics and get rid of it before she goes in to give birth. So that's the main disease that you have to remember, Strep A galactiae. Of course, there might be a few other things out there, but this is the only one that I need for you to remember. So the way that I like to remember it is Group B for baby, all about the baby on this one. Okay, so there's that quick mention on Group C, and there's also mention on Group G a little bit here. Again, we are not really that concerned. I don't even think I test you on this, so because I'm more worried about A and B on the beta hemolytic. Now, let's go to Strep pneumoniae. He is another huge pathogen. This is one that does not have one of those Lancefield groups, and he very much is alpha hemolytic. And I'm not sure why I call him a he. I just do. Sorry, don't mean to offend. It is alpha hemolytic, and this is the one that occurs in pairs. It's not usually in chains. It's usually in those cat-eye-shaped pairs that we saw a picture of. So we call it a gram-positive diplococci. Diplococci meaning pairs. It definitely has a virulence factor in a form of a capsule that will make sure that it doesn't get phagocytized by the neutrophil, so it can't get eaten up. And that's the biggest key to how it can cause disease and virulence. It can be found a little bit in the upper respiratory as normal flora, but it is named pneumoniae because it is the #1 cause of pneumonia, so that's a lower respiratory infection. It is also a huge cause of meningitis. So two very big diseases associated with this. So #1 cause overall of pneumonia, and it is a large cause of meningitis. So keep that in mind. Viridian Strep is another one with no Lancefield group, and this is our other alpha hemolytic strep. Now, Viridian Strep is an entire category of minor alpha hemolytic strep. It actually, there's a ton of alpha hemolytic strep all just thrown together under the title Viridian Strep. So a couple of examples here would be Strep mutans, Strep mitis, and there's a bunch more. So these are all more opportunistic strep. They don't cause a ton of disease, but once in a while they will pop up and cause something. But overall, we just group it under and say, oh, that's Viridian Strep. It's the other alpha hemolytic streps. So if these do cause disease, they tend to either cause endocarditis or dental infections. We often call it dental caries, so dental infections. So those are two of the biggest diseases that they do tend to cause if they're going to do anything at all. Enterococci is, again, any hemolysis. You might hear this one called Group D strep. Yes, it is an entire genus called Enterococcus. It has its own species under it, but sometimes people just call it Group D strep, even though technically it's not a strep, it's an Enterococcus. But just in case you ever hear referred to Group D, a lot of times we're talking about Enterococcus. So Enterococcus faecalis and Enterococcus faecium are the two most common species that will cause infection. I definitely see these in the lab when I work there. Enterococcus overall is mostly associated with nosocomial infection. And just a reminder, nosocomial again means hospital acquired. So if that patient was admitted, say, for surgery, and while they were in the hospital, they picked up a UTI, that would be a nosocomial infection. They got that infection from staying in the hospital, maybe from a medical instrument or somebody not washing their hands in between patients, something like that. So Enterococcus does cause a lot of UTIs. That's primarily where I saw it when I saw it in the microlab was UTIs. Again, usually nosocomial infections. This is also the very first gram-pos cocci that ever built a resistance to vancomycin. We did a discussion post already on that, and you know that it's called vancomycin-resistant Enterococcus VRE. So we already have discussed resistance, but just a reminder there. Okay, so we've hit the highlights of every main organism out of this chapter that I need you to be aware of. Now let's talk about how we test these. And you guys will do some of this in the lab. The biggest things are, of course, there is a strep kit. So if we ever think somebody has strep throat from Strep Tiogenies, we can easily swab their throat, throw it in a kit. If you guys have ever done a pregnancy kit, a mono kit, they're all kind of the same. They all have simple instructions. Oh, you put a drop of this and then a drop of that, swirl the swab. You know, it's really simple. Anybody can do it. So there is definitely a quick antigen detection strep kit to quickly tell the doctor, yeah, they have strep throat. No, they didn't. If they had a negative result on that kit, we will still culture the other swab. Usually when somebody gets their throat swabbed, we're using 2 swabs. We'll put one of those swabs in the kit and test it, and if it was a negative test result, we'll take the other swab and streak it out on an agar plate, a blood agar, and put that in the incubator, and then we'll look at it the next day, because sometimes it will show up positive even though the kit said no. And that's because some of those kits have a low sensitivity. So we want to be thorough. We want to make sure that we're truly saying, yes, they have it, and giving them antibiotics if they do have it. So it's just a confirmatory backup method to the negative kit results. There is also kits available for that Strep A galactiae. So again, some labs will commonly have a Group B strep kit on hand, especially if they do a lot of screening of pregnant women. It's a quick, easy way to test to see if they were positive for carrying that Strep A galactiae. All right, as you know, we of course always gram stain. That's always the #1 test that we run anytime we get a culture in. Besides the antigen detection, we always gram stain. After we streak it out on agar plates, grow it, then we take a little of the colonies, gram stain it. Again, you're going to see all gram-pos cocci with strep and enterococci. They're typically in panes. Again, strep pneumoniae is usually that lancet or cat eye shape in pairs. After you see the gram-pos cocci, you're going to catalase test it. It is catalase negative. Just a reminder, Enterococcus once in a while might show very weak catalase positive reaction. This is just a little bit on media. When we grew out the cultures on agar, we're of course always growing on sheep and chocolate just because they're supportive. They grow everything. Would we grow it on McConkey? Well, no, these are not going to grow on McConkey. Are they going to grow on CNA and PEA? Yes, definitely. Because remember, CNA and PEA both grow gram-pos cocci bacteria. There is another agar that we have not discussed yet called the limb broth that will be used specifically for looking for Group B strep during pregnancy. The reason they use this limb broth is it suppresses any other normal flora of the vaginal tract from growing, so that way if Group B strep is present, that's allowed to grow and be detected. So, streps tend to like a little bit more CO2 environment. So a lot of times we'll put these in a candle jar or a bag and create a higher amount of CO2 for it. They just thrive with a little extra CO2 than normal. And then again, sometimes some labs will have you stab the loop several times into the agar. So you can see here, usually you do this just in the primary quadrant. In my experience, I always did it in the primary quadrant. Your lab instructors might say they've done it in other quadrants. I've always just done it in the main quadrant. And what that stabbing does is if it's a group A or group B beta hemolytic strep, it really highlights that beta hemolysis and lets it shine through, as you can see in the bottom picture. So it's just a quick, easy way to be like, oh, there is beta hemolytic organisms here. I need to work up that beta hemolysis organism to see if it's a strep. Okay, so again, I said the whole flow chart process for streps will depend on the hemolysis. So once you see it's gram-positive cocci, catalase negative, then you look at the hemolysis. If it's beta hemolytic, you are going to do a bacitracin A disc. And then depending on your lab, not all labs do everything, but you can do a CAMP test, a hipurate test, or a PYR test, or you can do all of them. If it's an alpha hemolytic, you are going to definitely do the Opticant P disc and a biosolubility. If you think it's Enterococcus, because remember, Enterococcus is a little tricky because it can be any hemolysis, you are going to run a 6.5% NaCl, a bile esculent, and a biosolubility. So let's just go through a few of these. Here is the bacitracin A disc. It's called an A disc because it has an A on it. Imagine that. So this is an antibiotic disc. Bacitracin's an antibiotic. You simply streak out your culture onto an agar plate. They did it a little differently here just for picture purposes. But you just streak out your plate in the quadrants like you're used to, and you put the A disc in the primary quadrant, the area where it's thickest. And you're going to read it the next day after it's incubated for a zone of inhibition. Now, you guys did this with your antibiotic stuff. If there was a zone like there is on the left side, that means that the bacteria was susceptible to bacitracin. So this would be susceptible on the left side. On the right side, if it grew right up to the disc, it is resistant, meaning that antibiotic did not bother it at all. So gosh, I cannot talk to me. Again, bacitracin A disc is run on our beta streps. So that's Strep Tiogenies and Strep A galactiae. Strep Tiogenies, which is group A strep, is susceptible. So the left side, so group A strep, Strep Tiogenies, is very much susceptible to bacitracin. Group B strep, Strep A galactiae, is resistant. That would be the right side. So that you can see how this one test will differentiate whether you have group A Strep Tiogenies or group B Strep Tiogenies. Because remember, they're both beta hemolytic, they're both gram-positive cocci, they're both catalase negative. You have to figure out what you have, so this test will allow you to do that. So again, group A Strep Tiogenies is susceptible, and group B Strep A galactiae is resistant to bacitracin. For the CAMP test, group A Strep Tiogenies is negative, group B Strep A galactiae is positive. And this is showing a positive CAMP right here. So a CAMP test is a streak of Staph aureus and then a streak of your suspected organism. So you get the beta colonies and streak it out. And it will form a beta hemolytic triangle between the two where the two meet if it is positive. So you can see that. So you have a streak of Staph aureus and a streak of the suspected organism. And if it formed this beta hemolytic triangle here, that was positive. So again, Strep Tiogenies is negative for CAMP. Strep A galactiae, group B, is positive for CAMP. So this is another test that will separate them out. You can also, so that's it. There was also a PYR test mentioned here. Group A is PYR positive. Group B is PYR negative. And then hipurate is group A negative, group B positive. Again, if you didn't get all that, just stop, listen to the recording, pause it, write it all down. This will also come easier as you do more lab tests and look at flow charts, things like that. I have a couple flow charts examples at the bottom of this PowerPoint. I also have a couple that will be in the announcements on Wednesday, just to keep those in mind. So please make sure you know those 4 test results for sure, and that will help you determine if you have Strep Tiogenies or Strep A galactiae. Now we're going to go to our alpha strep. So the alpha strep, remember, are either Strep Pneumoniae or the Viridans group, which is the more minor alpha hemolytic streps. So Opticant P disc, again called a P because it has a P on it, is a huge antibiotic disc that we run with this. Strep pneumoniae will be opticin susceptible, so we'll definitely have this big zone around it like it shows here. Viridian Strep is opticin resistant. So again, Strep pneumoniae is opticin susceptible, and Viridian Strep is opticin resistant. You can also do a bioesculin test if you have Enterococci. Enterococci is bioesculin positive. Everything else would be bioesculin negative that we've been talking about. There's a couple others. I'll just go back. Biosolubility. Strep pneumoniae will be biosoluble, so that would be positive. Viridins is biosolubility negative. And then the rest of the Enterococci test, 6.5% NaCl will be positive. Enterococcus loves to grow in this solution. It just thrives in that solution, so that would be positive. Again, Enterococcus is bioesculin positive. And then finally, Enterococcus is negative for biosolubility. Okay, so now that we looked at a few pictures, you can look up the rest of those pictures if you like. But here's a couple examples of flow charts that you can use. Like I said, you gram-pos cocci, they catalase negative. If it's beta hemolytic, because this is this chart, they bacitracin discus. If it's bacitracin susceptible, it's most likely group A. If it's bacitracin resistant and CAMP positive, it is group B. This has a few other things on here that we didn't always talk about, but that's there. Here's an alpha hemolytic strep flow chart for you. Again, the opticin disc tested, susceptible Strep pneumoniae, resistant, and it kind of works its way down from there. So now it mentions at bottom here group D strep. I said Enterococcus sometimes is called group D, but there are other strep that are also called group D. I know, it's confusing, but just so you know. But this kind of shows you exactly how laboratorians and microbiology test. So we start with reading the agar plates, we then gram stain, we then do the next step, and then it goes to the next step. So you use these to really figure out what tests you need to perform next. So really get to know the order of tests. You don't have to know everything. Just do your best, but really know those tests that we mentioned specifically in this PowerPoint, because those are definitely going to be the ones that might be seen in test questions on quizzes. Okay, that's enough information. It was a lot. It will hopefully help as you go to lab and the stuff starts to come together. So again, as always, please give me a shout if you need anything. Others, have a fabulous week. Thank you.